Hi guys, quick impromptu live video. I've got 15 minutes till my next client and I've been desperate to laser my own knees. So I thought I would turn it into a little live about managing expectations of laser hair removal and sort of how different parts of the body respond, long-term results, that kind of thing. Now, I very rarely do anything to my any hair at all. I've had laser hair removal for a long time. I pretty much don't touch anything, I don't shave anything. But it was worth sort of mentioning how long you have to spend to get to that point and what the long-term results are likely to be like. So we generally recommend a minimum of 8 sessions per area. Face will always need more. Face is a hormonal area. It's going to take more treatments than 8, but we manage that as we go. Face is often maintenance ongoing. With bodies, a lot of places market 6 treatments for laser hair removal on the body. I've always said a minimum of 8 and then keep going to the point that you're happy. So 8 might get you to a point where you can whip a razor over once a month and it's bloody marvellous. It might mean you don't have to do anything for 6 months. It might mean you're still shaving every sort of 5 or 6 days because everybody is really, really different. Now, I don't really know exactly how many I've had. My initial course 10 years ago was 6 sessions and I did 2 or 3 additional ones on top of that. And then since I've had the machine, I've done sort of spot sort of top-ups and things like that. So I've probably got the results of if you consistently and with the right time gaps had maybe 12 to 15 sessions. But what that means is that I don't have to treat anything at all. Bikini does need a sort of annual top-up, and it's been long enough now. I said I had mine done originally 10 years ago, so I feel like I'm at the point I should probably do 3 or 4 in a row to get it back. However, with a bikini on, there is nothing to see anywhere, and what is there is so minimal and so soft I can whip it off with a razor. Same with my underarms. From a distance, no one else would see anything under there at all, and a quick razor whipped over a couple of times a year is more than enough for that. I don't even know that laser would do anything more to the hair that's there because it's so soft. The only area that I have had to maintain, bizarrely, is my kneecaps. The rest of my legs I don't shave. I used to have very coarse hair, I used to have terrible ingrowing hairs, shaving rash, that kind of thing. I don't need to do anything with any of my legs at all now, but for some reason my knees never quite got where I wanted them to be. My theory for that is that the skin is a bit thicker on the knees and it can take a little bit more to really sort of get that to where you need it to be. I've been lazy and I've not been consistent with it, so it probably could be a lot better than it is. I do occasionally see this with clients, not always, but occasionally I will have to bring them back a couple of times for knees. I invariably do that for free, particularly if they're having other areas done. But it is one of those areas that needs management. You may have seen a post I did the other day showing one hair, and this is where the expectation management comes in. So I've done nothing except maybe whip a razor over some soft, fine blonde hairs on my legs for the last couple of years, apart from my kneecaps. But occasionally, because the body is programmed to put hair in various places, it might go, hang on a minute, there used to be some hair there, I need to put hair there. And the picture I put up was of one coarse, dark hair that's about that long. And I've resisted the urge to pluck it because I was going to do it as part of this treatment. Now it's quite high up on my shin, so what I'm going to do is do knee and that hair at the same time. I'm going to cover them in the same treatment so you can see what it is I do. Now for me, given that I originally started it 10 years ago, was consistent for the first sort of 12 months and then haven't been consistent, I still consider that a really, really good result. Shaving and hair removal, waxing used to consume so much of my time, stress and energy that to not have to think about it now is fantastic. So just the occasional treatment like this, or the occasional, you know, I said I could whip a razor over it. My knees, I think I'd like to get a little bit further. Anywhere else on my body, a cheap Bic razor and some shower gel and I can whip that off, and I would only maybe think about that before a holiday now. So it is possible to get to that point with laser hair removal, but it doesn't happen in 6 sessions. It doesn't even happen in 8, but 8 can get you a very long way there. What would happen with 8? I say between 70 and 80% permanent reduction for 8 sessions. And then keep going at the same point until you get to the point where we go, right, let's leave it for 3 months or 6 months and see what happens. And then what happens is people then come back for top-ups, or I'm going on holiday, I could do with a quick once-over. In fact, I think I've got one of those this weekend. Someone's messaged me and go, I think my legs need a quick once-over. Don't think I've seen her for a year, at least, maybe 18 months. So this is what we're looking at getting to. I can't predict your hormones, your body going, I'm sure that part of my body should have some hair on it, here you go, because you've got hair follicles that have not yet been used. Those dormant hair follicles can be brought into play by the body, and I can't predict that, I can't prevent that, and it's just a case of managing it. We can destroy the bulk of them, and then we manage what's left. It's very rare for somebody to get no result at all, as long as their hair colour is appropriate. I think I've seen 3 times in 7 years somebody not respond how I would want them to, and I can't always give an answer for that, but generally speaking the results are fabulous. So what I'm going to do is I'm going to re-angle this camera a little bit. This is a little bit difficult for me because I have a foot pedal as well that I'm going to have to sit on that. So bear with me just a second while I get organised here. Okay, so because you don't want to see me now, you want to see my leg. I'm hoping that the machine isn't too loud for you to hear what it is I'm going to talk to you about. So all I've got here is some of the gel, or what I haven't got is a spatula. So I need to grab a spatula. We've got the laser gel, my goggles, a little shaver, and my foot pedal, which I'm going to have to sit on. So hold on 2 seconds while I just grab a big lollipop stick. I'm banking on my scrubs coming up high enough so you can see here. Okay, so my very attractive hairy knee. So I don't know if I can bring this in close enough. So if you can see here, what's the light like? Yeah, you can, look. So it is just my knee. Now this it had anything done to it for a very long time. And what it is quite soft. That rogue hair that I was just telling you about that I had seen come through, you can probably see there if I put my hand behind it. I'm not sure if you can. Give us a thumbs up if you can see it. So this is the bit that I want to treat. The rest of my legs, you can probably see there literally isn't anything there at all. It's soft. Anything that is there is very soft and fine. There's nothing dark there. It's just this random one here, and my kneecaps, which we've just said is my little problem area that I don't pay enough attention to. So today you get that as my little life. So what I need to do for all laser hair removal, you shave the area prior to treatment. So that's what I'm going to do with my funky little clippers. The smoother it's shaved, the less likely you are to get any little zaps. This is a genuinely pain-free treatment, but if you have too much longer hair, it can leave you with a couple of little zaps. I mean, that is it. Right, here we go. This really long one that has been bugging me, it's going to go. Here we go. So that is the one that I did the pictures about. So the way that... my clippers have just... Live telly, eh? My clippers have just fallen apart. So, there we go. Nice and smooth. We're going to get the gel. It's funny how my audience has just gone up since I flashed my knee at the camera. I'm glad to think you all want to come and see my kneecap. So that's the bit I'm going to treat. Like I said, I hope the laser isn't too noisy. Obviously I have to wear my laser goggles for this. And it's the first time I've done laser hair removal without a mask on. I don't need to protect myself from myself. Okay, so this is the laser. You'll see it flashing, and I will be managing how hot that is getting. So I can't feel that at the moment. Okay, so what I'm doing is just covering the area I want to treat. What will happen is any of these hairs that are going to respond will fall out in the next couple of weeks, and then there'll be no hair there for 2 weeks, and then the next hair cycle comes through, and I need to be on top of that. I need to do probably 3 or 4 in a row to make sure that I get a good result on these knees. Now I can be a little bit more aggressive with it as well. I felt a little zap there. I think that was where that darker hair was. So that very dark hair in the hair follicle has absorbed a lot of heat, and it just felt like a little prickle. This is not painful. This isn't the electric shock, rubber band flicking. It really doesn't feel like that at all. It's just warm, and with the occasional little prickle if it warms up too much. That's my job to manage. So I haven't done the rest of my kneecap yet, so here we go. So with that area that I did, that's a full treatment on that little area. It's really quick. That would have been, that first bit I did before I moved up onto my knee here, is what it would take to do one underarm. So I can do a full underarm treatment from in through the door to out again. We can do it in less than 10 minutes, 7 or 8 minutes for an underarm. Underarms are £79 a session. I don't do course bookings anymore, partly because, as you've seen, everybody responds really differently. I brought my prices down a little bit to manage that, and then everybody just pays for what they need. Then you're not committed to more than you need, and I'm not pushing anybody to part with big chunks of money up front. And I think that's important in this environment as well, given the climate. People don't know what's going to happen. I'm very secure in my business. We're busy, but if we had another 6-month lockdown, I would hate to have people's money trapped inside my business. So we do pay as you go, and we're nearly there. Oh, I've done loads. So that has had plenty. The beauty of this type of laser is you can't overcook someone. Well, I probably could, but for the sort of treatment I did, you can go over and over an area. So if there's some fine hairs in there that need a bit more welly, we can do that. Speaking of giving it a bit more welly, I am going to do something that I would normally only do on people's faces, but because my knees are stubborn little so-and-sos, I'm also going to do a single shot treatment as well. This can be a little bit hotter, a little bit sort of pricklier, a bit more like the rubber band thing you hear of other types of laser, but they're single shots, and all I'm going to do is do this on the really stubborn bits around my knee. It feels like little tiny pinpricks. It's not unbearable, and it's important to get on top of this because it's annoying me now. Where did that individual one go? Where was it? I'm going to give it some. Oh yeah, that was it. So quite often, because faces can be a bit stubborn, they're very hormonal, I often do a full treatment on the face, and then I go across and do these individual shots to boost that result, because faces, like I said, can be a bit troublesome, and we want to get the best result possible. So although the laser hair removal with this machine is pain-free, sometimes I do ask people to go with something that's a little bit zappier to make sure we get a result for them. So that's more than enough there. I can feel that, but it's fine, it's not too bad. So that is a full treatment, a very robust treatment on that knee. So, by the way, if anybody's watching has got any questions, do ping them up, and if I don't catch them while we're live, I will answer them later. I can do small areas on the same day as a patch test. Obviously, if you booked a half-hour patch test and you want your legs doing, I wouldn't have time to do that at the same time. But if you've booked lip and chin, underarms, even some of the bikini treatments, I can sometimes do that on the same day if there's time in the diary. So you can come and find out if you want to go ahead and treat on the same day if you want, but there isn't any obligation to do that. Hold on. Ooh, just swap my legs around. No one is obliged to book on the day, because actually I want you to go away knowing what it is you're booking for, and what the results are like to be like, and what it feels like. So I'm just going to do the other one. This one isn't as bad actually. I don't know if you can see from there. And I've really let these go. I mean, this is months of me going, right, I really should sort these out. So again, I'm just going to whip a razor. This will be a quicker treatment than the other side. Like that, there we go. Oh, I am keeping, I have got a client very soon, so we're nearly done here. Bear with me. Okay, last little bit. This will take about 45 seconds. But yeah, any questions, just give me a shout, and I will answer them for you. Here we go, last little bit. There we go. No, this genuinely, honestly doesn't hurt, okay? For people who are concerned, there's no need for any of the treatments to be painful. If you don't want to go for the zappy stuff on stubborn areas, you don't have to do that. That's an extra we add on if it's required. Like I said, usually more for faces. So what would happen here then, for those of you who've just joined us, I would expect within 2 weeks for this to be starting to fall out. You're left with no hair, because all of the hairs themselves will be destroyed. For about 2 weeks there'll be no hair in that area, which is fabulous. And then 2 weeks after that, the next hair cycle will start to come in. So we treat body hair, at around 6 weeks. And as it starts to improve, gaps between treatments can increase depending on the speed of the hair cycle. So there we go, that's done. Very quick treatment. I will come back in a couple of weeks and show you the results of that. Anybody got any questions, just give me a shout. Consultations for laser hair removal are free if you have treatment. So basically I charge £30, which also confirms your appointment. If you go on to have treatment, I will take that £30 off your first treatment. So it is your money. If you come in and have a consultation, we spend half an hour together and then you decide not to go ahead, that has covered your appointment time for that half hour. But otherwise, if you decide to go ahead with laser, I can take those off now. If you decide to go ahead with laser, then I will give you that £30 towards your first treatment. So anybody got any questions on expectations and length of treatment, results, that kind of thing? If you've just come in, there's a couple of you just jumped in now, go back and have a look at the beginning, see what I've said, how I've talked about, number of treatments required, expectation of results, long-term results. Like I said, I started my treatment 10 years ago, nearly, and I very rarely have to do anything. The first bulk of that treatment was in the early stage, and then I did another chunk when I got my own laser, and I rarely have to do anything at all. So hope that's useful. Please do ask if you've got any questions. There is an offer out for chests and backs at the minute. So guys, if you are tempted to have chests and backs done, there is an offer on full chest and full back for that first appointment. So have a look at that and see what you think. Share this out for me, tell people about it, that would be really helpful. There's a few familiar faces popping up here, brilliant. But I am going to have to go because I think my client is sitting outside and I can't keep her waiting. So have a lovely day, ask me whatever questions you need, and hopefully I will see some of you guys that are watching on the sidelines in the clinic really soon. Have a lovely day, I'll speak to you soon, bye.